So welcome everybody. Some of your faces I know, otherwise welcome, and we're going to continue on the theme. So I'm going to continue along the topic of inclusive care, and as already has been mentioned for most of it, that inclusive care is about providing that sort of equitable and culturally competent, compassionate care. And the dot points there are the things that I'm going to speak to. So that whole, principles around inclusive care is that as nurses, we're ethically obligated to treat all of our patients with respect and dignity. I think that's something that we've all been taught from the very beginning of any of our nursing education that we've done. And we advocate for those patients as well. So not everybody's able to speak up for themselves. And so nurses are ones that are there beside them to assist with that, for that principle around that equity and the advocacy. We also then look after vulnerable populations. So those of you that have done any work here at IIHS in the community know that there's populations of people who need assistance in accessing healthcare and receiving any kind of medical attention that they might need without any prejudice as well. The second point there is around cultural competence. So, Michelle did mention about that understanding the diversity of the people that we care for and recognising how factors like your ethnicity, your customs, and even your socioeconomic status can actually influence the way that you approach healthcare or not approach healthcare. And I'm sure in Sri Lanka, as it is in Australia, there's a wide variety of differences around that. So if we can provide culturally competent care to anyone that we come into contact with, it means that we can address their needs in the way that they need them to be addressed. It's not very easy to do sometimes because it can be resistive at some points. The other point there about education and training, which obviously, standing here at the university is one of the passions that we have, is that the education that we give you provides that vital role in preparing future nurses for inclusive care. So before you come into the university setting as a student, you may not even think about what does inclusive mean? What does that actually mean in the terms of healthcare? So we try to make sure that we integrate diversity and inclusion strategies into the curricula that we deliver. That helps you to develop all the skills that you need to give a personalised care and to try and address any of the disparities that might occur within that. Inclusion health, if we look at that concept, it refers to the needs of some of those groups that are excluded. So it might be people that are homeless or people that have complex needs that find it difficult to access care, maybe because of the cost of care, maybe because the distance that they need or the physical ability to get to care that actually can suit them. So as nurses, we can be aware of these issues and try and improve the health outcomes of all people, hence back to our topic for the conference this time, Health for All. So it's about trying to understand what people need and trying to find a way of giving them access to what they need. And obviously it needs to be timely and appropriate for their actual healthcare. The next point there is about having a diverse workforce. So if we can foster that inclusiveness about the people who come into the nursing workforce, it means that it can enhance the quality of care as well. So if you're being looked after by someone or someone's advocating for you that is from your similar background, then it means a lot more than if it's someone who you feel cannot understand your background or from where you've come. So it means that we can respond better to that diverse needs of the population. And I feel in days like this with these conferences, when you look around the room at the different people that are here, not just us from other countries, but within your own country, it is a diversity. So the people that you are looking after may have that same diversity. So the fact that they can recognise someone as being perhaps similar to them can assist in helping that sort of inclusive care as well. Can I have the next slide, please? This isn't working. Is it turned on? Next slide, please. Thank you. I've only got 3. It's not a lot of work. So our focus as I mentioned there, was about looking at that multifaceted approach that empowers the nurses, and education and training is one of those areas that we can do that. So we try very hard to make sure that we include cultural competence within our training, and humility, and having those discussions amongst us when we're doing anything within that training. Trying to get you to understand that we all have what we know as implicit biases. So we all have within us a bias that we might not actually be overtly aware of. So just understanding that can help you to mitigate any unconscious prejudice that you may have when you are looking after people from other classes. And obviously promoting access to other languages as well. I know that in this country, there's a lot of different parts of dialects in the language. So the fact that you can actually understand or at least translate in some way with those, but also moves to those people who perhaps do not hear and use sign language, for example, or people that cannot speak properly and have problems in that way. How do we converse with those people as well? So we need to try and include those things in our learning as well. Policy and institutional support. So every organisation should have something that comes along the lines of a diversity, equity, inclusive kind of framework, and that they really make a point of trying to make sure that they recruit from all of that different areas as well. And there should be inclusive policies around gender, disability, and religious practices as well. The community engagement, as I said, I think that's one of the things that happens well here at IIHS. And hopefully those of you that are nursing students have had an opportunity to do some of those community clinics or be involved in some of those things. So that's part of trying to partner with any local organisations so that we can do those outreach programs where we can perhaps get that primary healthcare message to those outreach areas, mobile clinics, home visits, all of those kind of things. So if you ever get the opportunity, make sure you put your hand up and you get involved in that. And from that, making sure that we get feedback from those people who attend those clinics to see if that's what they do need, what else would they like, and what other things can we plan for in doing that. So it's working to expand your selves as well as the people that we're serving as well. Obviously then around that advocacy and leadership area, as nurses, I think over the years that I've been a nurse, we've certainly become better at making sure that we have a voice up at the top with the Parliament area, people that make the laws and the regulations and those kind of things. So making sure that you speak up about the things that we're achieving and the things that we can continue to achieve. Technology and innovation, we've already talked about that today in that, with COVID occurring, it meant that we all suddenly were able to use technology a whole lot better than we used to do. Online classes, online sessions. In a country like Australia, which is really large, one of the good things that happened during COVID was telehealth became much more used. And prior to that, there wasn't actually a funded model where the doctor could actually charge for a telehealth appointment. So even me living in a city can actually ask for a telehealth appointment for certain things. So if you've had a blood test, why do I need to go back and sit in the waiting room and then go and see the doctor to get my results? Why can't we do a telehealth? So those sort of things about using all of those digital tools. We've all been able to use, even just on your everyday phone that you've got, you can access language so that you can speak to patients or show them pictures of things, getting that information from them as well. And of course, AI. I've talked a bit about AI while I've been here these last few days. And AI is not evil. AI is for good as well. So in university spaces, we tend to get nervous about AI and that you're plagiarising, but you can use AI for good things as well. So don't forget that. And then Michelle also mentioned about that reflective practice. So making sure there's a safe space amongst us to discuss things that have happened. How could I have handled that better? That distressed me. The person was distressed, whatever it might be. And that helps you to get over those challenges perhaps, and perhaps have some kind of resilience for the next time that something happens that is distressing, that you know how to perhaps manage it a little better. And keep a journal. I think I should like to tell all nurses the day one that they start their nursing course, whatever it might be, just keep a book that you write things down in, good, bad and ugly, I say. And when you finish your course, your degree, whatever it is you're doing, which may well be 3, 5, 6 years later, you look back at day one and you actually start laughing at the things you wrote down because you were worried about where were you going to park or how did you get there and was anyone going to talk to me and was I going to be the only one and, that kind of thing. And then after you've been doing it for 3 to 5 years, you realize all the friendships you've made, all the experiences that you've had, how much you've grown, particularly if you're very young when you start. Even someone like me who started nursing at 17, that was what I was like. I was just nervous about, where do I go to the washroom, and do I have to take my lunch, and should I have my hair like this, that kind of thing. Seems so silly now. But same thing happens every time you start a new job. So that journaling and debriefing and talking about your cross-cultural encounters that you have, and also that celebration. So within that peer support, that celebration and when something's done really well. So if you have a colleague that tells you a story about something that happened to them, an experience they had, how they managed a patient or whatever it might be, and it just sounds like that was fantastic, well, make sure you tell them, because they're probably telling you out of nervousness and relief and all of those things as well. So we should tell our stories. And that's part of having that journal as well, that you can go back and look and go, oh, I remember when that happened. So all of those things put together can hopefully help us to be more inclusive. So just finishing up with that statement that if we can embrace all of these things, hopefully we'll get better outcomes for our patients, clients, and a more equitable healthcare system, or at least perhaps we can contribute to that. I'm not sure that we can do the whole. Thank you.